Internal bras come by a variety of types. And so the most common ones that we use here in Canada is we use what we call Acellular Dermal Matrix, or ADM. The one they use in the United States more commonly is called Galaflex, or P4HB. That is the chemical that makes up the mesh. They're both very different in terms of their properties. Acellular Dermal Matrix tends to stay around for a long time, doesn't induce very much scar tissue at all, while P4HB tends to induce a significant amount of scar tissue and dissolves away within about 2 years. P4HB is essentially the newer device or newer sort of mesh on the market, and there's not a lot of long-term studies that have been done to show what it can do. However, I believe, again, not having direct ability, having used the product, that right now it would be great for preventing malposition issues such as lateral malposition or inferior malposition. Acellular Dermal Matrix is great for preventing inferior malposition, I would say a little bit of lateral malposition, but it's really, really good for preventing capsular contracture. So in my practice, I've used Acellular Dermal Matrix quite successfully for massive weight loss patients or for people with recurring bottoming out, but also for people that have had recurrent capsular contracture. So that works well for both. P4HB has not been proven to have benefit in capsular contracture long term. Unfortunately, in order to know if something's going to be effective with capsular contracture, you really need to wait for about 10 years to see what the data is going to come out and say.